Breast. Sanjaya Adikari. Department of Anatomy. Consists of milk-producing glands. Glands are modified sweat glands. Assist reproduction in women. Rudimentary in men. Lies in the subcutaneous tissue. Extension transverse, LS beta mal. Vertical, 2nd to 6th rib. Position of nipples 4th ICS in males. 10 cm from AML. Size is variable due to the amount of fat surrounding the glandular tissue. Extent of the base is fairly constant. Suspensory ligaments of Cooper retromammary space posterior capsule. Connects the dermis of the skin to the posterior capsule. Retromammary space. Contains loose connective tissue. Posterior capsule. Condensation of the membranous layer of superficial abdominal fascia of scarpa. Pectoral fascia. Structure 15 to 25 lobes. Each lobe drains by its lactiferous duct. Lobes consist of many lobules. Lobules consist of alveolar ducts. Lobules are separated by loose connective tissue. Lobes are separated by dense connective tissue. Of Cooper. 15 to 25 breast lobes. 15 to 25. Smooth muscles. Resting breast lobule alveolar ducts lined by cuboidal cells. Myoepithelial cells between the cuboidal cells and the BM. Cyclical changes according to the ovarian cycle. Breast during pregnancy. Changes due to estrogen, progesterone, prolactin etc. Numerous secretory alveoli formed by proliferating alveolar duct epithelium. Interlobular connective tissue becomes less. Alveoli and ducts get filled with colostrum. Colostrum is a protein-rich fluid containing maternal antibodies. Breast during pregnancy. Lactating breast consists entirely of glandular tissue. Alveoli are dilated with milk. Interlobular connective tissue disappears. Prolactin promotes the production of milk. Oxytocin causes contraction of myoepithelial cells and ejection of milk. Lactating breast. Blood supply. Thoracoacromial. Drunk. Development of breasts. Mammary lineage develops at 7 weeks. Thickening of epidermis. Persists only in thoracic region. If persists in other regions cause accessory nipples, common in axillary region. Epithelial sprouts formed and canalized. Axilla. Inguinal region. Development. Tont. Lactiferous ducts open into an epithelial pit. After birth a nipple is formed by proliferation of underlying mesenchyme. Persistence of epithelial pit causes inverted nipples. An underlying tumor can also cause nipples to invert. Lobule formation occurs only in the female after puberty. Lymph drainage. 75%. 25%. Lymph drainage about 75% passes to axillary nodes. Rest of it mainly passes to peristernal nodes. Superficial lymphatics of the breast have connections with the opposite breast. Axillary lymph nodes. Apical. Lateral. Anterior. Posterior. Central. Flow of lymph from axillary nodes. Jugular lymph trunk. Subclavian lymph trunk. Right lymph duct. Breast quadrants lump upper outer quadrant bulk of the tissues 4 cm. Most benign/malignant conditions occur in this quadrant. Suspensory ligaments of Cooper. Dimpling. Retromammary space. Posterior capsule. Pectoral fascia. mammogram, tumor. Tension lines of the skin. Tension lines of the breast. Surgical incisions. Luctiferous ducts. Radial incision. Mastectomy, radical mastectomy, modified radical mastectomy. Whole breast, beck, major and minor. Axillary fat, fascia and delens. Preserve beck, major, but remove beck, minor. Only the breast. Breast with axillary tissue. Radical mastectomy. Modified radical mastectomy. Simple mastectomy. Extended simple mastectomy.